In today's video, I interview Fernando Espinosa, a sports physical therapist who works for Twin Cities Orthopedics in Minnesota. Throughout this interview, we talk about things like sports medicine, physical therapy, things that you should be doing throughout your education and career. If you want to be a physical therapist, a sports physical therapist, or just work in something sports related and you want to know how you can get there, this interview is for you. So I am here with Fernando Espinosa. Me and Fernando met when I was still an undergrad at It was my senior year of my athletic training undergraduate career or life, whatever you want to call it. And Fernando was doing his, sports PT residency, correct?
Correct. Sports physical therapy residency. Yep.
Sports physical therapy residency. That's a lot to say. But yeah, that's pretty much how we met, and we're just going to talk about his life, how he became a sports PT, and hopefully you guys get some good information out of this. So Fernando, take it away. Just tell us a little bit about yourself, just like a basic background so that people who are watching this can get to know you.
Yeah, sounds good, Nanny. First of all, thanks for having me on. I love talking about myself. But I feel like, I'm just kidding. I feel like I've had a great experience to this point in my young career, pretty young, 27, but I've had some cool experiences. First grew up in Madison, Wisconsin, far away from where I met Danny in Miami, Florida.
Yeah.
Grew up playing sports, never really knew what I wanted to get into career-wise, but went to college, played some baseball in undergrad. And kind of just found PT through shadowing and things like that. And went to University of Wisconsin-Madison for PT school, and then found myself down at the University of Miami with a pretty cool experience working with the Hurricanes athletes part-time, and then outpatient clinic the other time. So that's where I met Danny, and got more questions to come up as we go, but look forward to chatting with you.
Yeah, I remember, I think we actually met in the fall semester. But then I had a really long gap where I wasn't going to the training room as much. But I remember that spring, we worked a couple of track meets together and stuff like that. So yeah, but so pretty much, when did you find out that you wanted to become a PT? Not even specifically a sports PT, but just physical therapy. When did you say, you know what, I want to be a physical therapist? When did that come to your mind?
Yeah, that actually wasn't until my sophomore year of undergrad. Going into undergrad, I didn't quite know what I wanted to study. I was pretty good in math and science. Always was fascinated by the human body. But if you asked me my freshman year of undergrad, I think I would have told you three different things that are very different: pre-law, physics. I wasn't really sure what I wanted to go into. But like I said, I played baseball at Hamline University in St. Paul, Minnesota, Division III school up there, and started thinking about careers and majors. And I found the exercise science major my sophomore year of undergrad, and I was like, wow, this is pretty cool. You can learn about the human body, take all your science classes, a little bit of psychology classes. And from there, I shadowed in some PT clinics in Madison my sophomore year, and the rest is history. I fell in love with it. I was like, wow, you can never read out with people, tell people how to take care of their body. I thought it was the best thing ever, and here we are. 11 years later.
So you said you didn't really know what you wanted to do. So freshman year, what was your major freshman year? Did you change majors, or you're always exercise science?
I was undecided my freshman year.
Okay.
But I always enjoyed taking physics and math, and a lot of those classes, we'll talk about this too, fall into the prerequisites for getting into PT school in the first place. So my freshman year, I was knocking out all my basic liberal arts courses, and then a lot of my basic sciences that helped me to get into PT school later on. So
obviously now we know when you found out you want to become a PT, but exactly why did you want to become a PT? Do you think the sport, you playing baseball, the sports background, do you think that helped a little bit? Was it an influence, or was it more you shadowing as a student, or was it a mix of both? What exactly was it?
Yeah. So I failed to mention I also worked in the athletic training room at Hamline University my freshman year of undergrad. So literally, I think it was the second month I was at Hamline, I was in the training room. So right out as an 18-year-old working in the training room as a sports medicine assistant. So there was this almost like a student athletic trainer type role, a little less formal, but learning how to tape ankles, help people with ultrasound, stretching, being on the sideline during football games, my sophomore, junior, and senior year. I was working on the sideline of the football games, which is like a huge responsibility. Even at a D3 level, it was a lot of work, a lot of responsibility. But eventually, once I shadowed my sophomore year, in the PT clinics, I decided that was a better route for me. So I think being an athlete and working in the training room kind of helped me be around the more athletic type population. And really, I think even when I found out I wanted to be a PT from the get-go, my sophomore year, I knew I wanted to be in sports.
Yeah.
I don't think that's super, super common. But I always knew that like I wanted a career. I thought of it as more, I wanted a career in sports. And like what career would put me in that path. And for me, I've been able to take my PT degree and turn that into working with athletes as well. So
yeah, now going back to what you said about being in the training room. So you're pretty much like, you're doing what an athletic training student does, but you weren't technically an athletic training student. We'll put it that way, correct?
Yeah. So my undergrad didn't have an athletic training bachelor's degree where I went to school at Hamlin. So I kind of, in a way, molded it myself by getting experience in the training room and having my exercise science degree. We had 2 classes required for my major that were taught by the athletic trainers at Hamlin. So there was a lot of things. I think I got as close as I could to an athetic training degree and bachelor's degree without actually having the formal title, and then obviously not taking the boards.
Obviously we know that that there's like a lot of overlap in athletics, like between athletic training and PT. Like you see a lot of athletic trainers that are also DPT, so they have like the ATC credential and they have like the DPT credential, and at the end of the day, a lot of them just like work together too. So I just wanted to like note that out really quick. But now obviously we know your journey. But for people that are watching this that literally don't know how to become a PT, can you just outline like the basic step-by-step process of how to get there? You don't have to go too into detail, but just like, I would say from like maybe graduating high school and then on, like just step-by-step, like how do you become a DPT? How do you become licensed? Like, how do you do that?
Yeah. So like I said, really the earlier you know you want to be a PT, the better probably. I didn't know until my sophomore year of undergrad, which is pretty early still, I think. But, I could have known in high school because there are some programs that do 3 and 3. So you do 3 years of undergrad and then 3 years of PT school. So you end up saving a year. So if you know pretty early on in high school that you want to be a PT, you can apply to those type of programs and get it going right away. But from there, obviously, I think the most important thing in undergrad is getting all the prerequisites for PT school. Now that varies by program. You're going to have the most common classes being like biology, physics, chemistry, and then a psych class, I'd say, is like the base what you need for PT school. From there, each program is a little bit different on specifically what type of physics class. You need a math class and any other type of classes that would be required for PT school. So the earlier you identify that, the better. You're saving time and money. That being said, the most common majors for PT students are like kinesiology or exercise science. But I know I had classmates in PT school who did not have that undergrad degree, whether it was like biology or even I know like music. Sometimes you can get a music major from undergrad, but still have all your prerequisites for PT school. So as long as you get the prereqs done in undergrad, that's the most important thing. And then from there, honestly, the next most important thing is getting experience shadowing. So they want to see, I know at UW-Madison, it was at least 100 hours of shadowing experience in a PT setting, in different settings too. So during undergrad, it wasn't very glamorous, but I can specifically remember in 2016 in January in Minnesota, I was driving about 45 minutes to an hour in the snow almost every day to shadow for no money, but it set me up to where I am right now. I'm at that same company 5-6 years later, and they remembered me. I made a good impression on them, and it's the things you have to do to get into PT school. I think I got like 20-30 hours with the company, and then I did an internship in undergrad at a more of a rehab institute, so a completely different side of PT from an outpatient setting, more of like a rehab institute. So patients were staying in this facility, and then we do like inpatient visits with them. So I got some experience there, and that's really what PT schools want to see, is a diverse diverse settings of experience, because they don't like to see that you put 100 hours in one of the same clinics, because
Yeah.
when you graduate as a PT, I should make this be known that you're a generalist. So that's part of the reason I took the route I took, was I knew I wanted to be more of a sports PT. So I ended up doing a residency after PT school at the University of Miami to kind of fast track my career in sports. Because when I graduated, I had some pretty good internship experiences in PT school, but I don't think I was the best PT I could be to best
Yeah.
serve the athletes that I was treating. And I feel way more confident after the year of residency at Miami with my phenomenal mentors and all the didactics that we took and all the extra hours in the training room to fast track my career. So that was a lot, but that's kind of how you get into PT school.
Yeah, so just to I'm gonna sum it up really quick, because I have a lot of viewers that they have this like mentality, or maybe not the mentality, but they just really don't know how the system works.
Yeah.
So they'll be like, "Oh, Danny, can I get a major in physical therapy?" But the reality is that that's not really a thing.
No.
So basically, obviously, you do your 4 years of high school, or just a high school degree, then you do your undergrad, which is 4 years, or it might be less depending on how advanced you are. And like you mentioned, you get a lot of experience, do your internships, do your prereqs, and then you go to PT school, which is 3 years, correct?
Yep, most do 3-year programs. Yep.
Yeah, so a 3-year program, you graduate, you have to take a board exam, I assume.
Yep, board exam afterwards.
Yeah.
Right.
So you take your board exam, and then you become what is known as a doctor of physical therapy, which is DPT, the physical therapy credential. And then you could do, it's a residency, correct? That's what it's called, a residency?
Yep, residency. Yep.
Yeah, so residency, and then you get a job. So it's, I don't know how many steps that was, but it is a step-by-step process. It's not just, oh, let me go to undergrad and become a physical therapist. You do have to go through many steps, just to clarify that.
Yeah, we'll talk about this more, but it especially when we start to talk about how do you want to work with the professional sports team, it's a long process. Like, yeah. I have made a lot of sacrifices, and you have to have a lot of people in your corner along the way to get to where I am right now. And even I still want to go different places, and I still need more people and more help. So it's a journey. But
yeah, I actually wanted to ask you that. Obviously, you've had a very long journey. A lot of stress in the classroom, in clinic. So how do you overcome all that stress? You know, obviously as a student, I'm pretty sure there was a time when you were studying in the library, just super stressed out, freaking out. Did you ever question your career? Did you ever question, oh, can I do it? How do I do it? Just how did you overcome that, that negativity that I think every student goes through regardless of what they're studying?
For me specifically, as a healthcare professional, I felt like I had to practice what I preached. So, I still tell myself this today. If I don't take care of myself, I can't take care of the 14 patients that I see every day. So if I'm coming to work and I'm tired, feel like I missed 2 meals, went out to party last night too much, things like that, and I show up to work and I'm feeling crappy, my attitude and my energy is not going to positively influence the people that I work with. So I think that in PT school early on, I prioritized working out, getting good sleep. I never pulled an all-nighter in PT school. Making sure I took care of my mental health, make sure I took vacations, time away from the books so I showed up to class and I showed up to my internships and my eventual job the best person I could be. So I think that's the best piece of advice that I could give to anyone pursuing something worthwhile is, yeah, you're going to have to make a lot of sacrifices. You're going to sleep a little bit less. But if you don't prioritize your health, especially as a healthcare professional, people are going to see that, and they're going to trust you less, and your quality of care is going to go down. So that's something that I prioritize, and I continue to do that to this day. So
yeah, no, we definitely hear about a lot of professionals, whether it's PT, AT, even physicians, that there's just a really high burnout rate. Obviously they'll make it to the finish line. If you're committed, you will. But you hear about all these things, a lot of people that study, they get very anxious, very depressed. And it's just because you're trying to balance all these things. But if you just stay focused on your goals, it definitely helps you on the long run. It's like you sacrifice a little, but you earn a lot type thing.
On the back end, yeah. This is something I told young Danny here himself when he reached out to me. I was like, you kind of have you have to turn out the noise. There's going to be a lot of people around you telling you can't do it. A lot of people trying to compete with you. But the reality is, I told Danny this, is we're all on our own path. And there are so many different avenues to be successful in. And the person next to me in PT school went a totally different route than I did. but we're still really close. Like there was
Yeah.
never like hostility or intense competition between us. So I think like if you surround yourself with the right people, those people will realize that like there's so many different ways to succeed in your career.
Yeah, no, I agree. But going back now, about PT, physical therapy, and specifically sports physical therapy. The reason I wanted to interview you is because technically, I guess by completing your residency, you are considered a sports physical therapist. And a lot of people say that. They say, "Oh, I want to be a sports physical therapist. I want to work in sports and athletics." But what exactly does that mean? Like, what does it mean to be a sports physical therapist? Like, what do you do that somebody who is not a sports physical therapist like does? And
Yeah.
also, how do you not just get there, but like what exactly is it that makes you a sports, like on paper, what is that makes you a sports physical therapist? Is it like just that fellowship, the residency that you do that like technically makes you a sports physical therapist?
Yeah, I think so. I took some time to chew over this question. Probably, this is the hardest question I get, and the hardest question I've gotten from you. I think to answer your question, anybody can be a sports PT. You don't have to have a residency. You don't
Okay.
have to have, a specific training fellowship. I think that like at the end of the day, it's are you best suited to treat an athlete and get them back to sport? I think that's what it comes down to from start to finish, from surgery or even pre-surgery to return to play. Are you a physical therapist that's able to take them that entire spectrum confidently? And I think that's another piece that I'm still working on is confidently. I've
Yeah.
only been working for a year and a half, so I have only seen like so many patient athletes who I've taken from start to finish. And so I think as my career grows, I'll become more and more confident in what I do. But I think, that being said, like you don't have to do residency. I think what you do have to have in some sense is really good mentorship. I think that like if you come out graduating with your PT degree and like I'm ready to treat athletes, that's pretty naive of you, especially if you just kind of ran through school and you have very little experience. I would look at them and be like, no, you're crazy. Like
That's like me right now saying, "Oh, I'm ready to be an athletic trainer for the Miami Dolphins."
right.
It's just no, you need that experience, that mentorship.
It doesn't just happen. And I think like back up to what I said earlier, like me being a physical therapist in the University of Miami athletic training room didn't just happen. I didn't just like,
Yeah.
back up. I didn't just graduate from Mount Hamlin, graduate from Wisconsin and show up and be like, all right, I'm ready to treat the Miami Hurricanes. No. This started my freshman year of undergrad, 2013, when I was in the training room working with Division III football players. Like from 2013 through 2020, I had 7 years of experience, mentorship, knowledge, life experience that I gained in that time to get to where I was and where I am today. And I think like at the end of the day, you can't fast track it sometimes. And I think even today I'm like treating an athlete, like, was that the best exercise to do right there? I don't know, but we're going to find out. It's a little bit of trial and error. In medicine, that's honestly what it is. Sometimes it's trial and error based on using the best evidence you can, the best experience you can, and what the athlete thinks is going to get them better sometimes. Now, the little piece that I think my residency did a really great job of that I think you wouldn't get is that day-to-day management of an athletic injury. And this is where, the athletic training PT, you kind of go back and forth. Like there's a lot of overlap. Now, in the training room, the majority of my responsibility was long-term rehab. So we had athletes who had surgery or had really, long-term cases that we were managing. And then there were athletes who would come in and, talk to the athletic trainers in Miami and be like, hey, can you help me here? My ankle's bothering me. Let's get it fixed up. I got to practice today. Now, as a PT, like going through, if you've never been in a training room, I doubt you're ready to be able to manage that, But there were times when athletes would come to me, trust me, respect my set of skills to be like, hey, my knee hurts. I just tweaked it at practice. Fernando, let's get you fixed up. And I think the vast majority of PTs might not be best suited to treat that acute management of an injury without being in a training room, however long I was each week, 30, 40 hours a week. If you're not, in that setting, that high high intense environment, you just don't have that experience.
So basically, what I'm kind of understanding from everything is like in order to quote unquote be a sports physical therapist, it's more about kind of how you work in the environment you work in and how you manage injuries rather than just doing a residency and on a piece
Yeah.
of paper saying, congratulations, you completed a residency in sports physical therapy. It's more about the experience and environment instead of the credential or paperwork. We'll put it that way.
100%, 100%. And this is where I think most of my colleagues would agree. Like the reason why I did this specific residency at Miami is because I knew that experience would provide me with that. And I think like if you are at the point where you're a physical therapist looking at a sports residency, you need to critically look at what they have to offer, because I know residencies are even in sports PT are very varying and based on their experience, like what experiences they have to offer. So yeah. And then the other piece I want to add in is like the like sideline management of athletic injuries. I think we're not best suited to manage them. I think athletic trainers are definitely like, say, like a spinal cord injury or, you know, even like dehydration, heat illness, heat exhaustion, that kind of thing. Athletic trainers are best suited. But I think as a sports PT, you should be at least familiar with, you know, how to assist the athletic trainers in managing those type of conditions.
All right. Now, the next thing I want to ask you, we're talking a lot about, kind of what you did at Miami. I'm asking all these questions about sports PT because this is what this video is about, just sports PT, sports physical therapy. But I get a lot of people ask me and a lot of comments being like, Danny, I want to be a sports physical therapist and in the NBA, in the NFL. I want to work for a college team. Like, I want to be like that person. But like, how do you actually get there? Because that's the question. Even when I was going into athletic training, I was always curious. Like, how do people get those? Like, obviously, they're very high paying. They're very high respected. Very well, reputable positions. I guess like not everybody is just a physical therapist for the Miami Dolphins. But how do you get there? Because that's what a lot of people want to know. And I think it's kind of like, I guess, this like secret that just people don't know about. So how do you actually get there? Because from what I've seen and my opinion about it, it's mostly just experience and proper networking and obviously good skills. But what's your side on it? Like, how about right now, I want to be a sports physical therapist in the NFL. How do I get there?
I think you really nailed it. I'm going to talk convoluted about how to get there, but it really is experience, being good at what you do, and then relationships. I think if I have to summarize what I'm about to say, it's that. But I think, I just told you exactly what got me to where I am at working with high-level Division I athletes. And I even considered working in Major League Baseball. I've had a couple interviews.
Yeah.
And, I think there are very few opportunities, especially as a physical therapist. There are less opportunities to work with a professional sports team than an athletic trainer. So you have to first recognize how much it does take, how much sacrifice, how much time, how much commitment it takes to the profession to become a physical therapist for a professional sports team. And with that becomes, there are people who've been in this environment for 20, 30 years. Like, you can't just show up and be like, yep, I'm ready to work for Major League Baseball.
Yeah, I think a lot of people, especially like I would say like when you're an undergrad and stuff like that, maybe even people like that are kind of like my age, like new upcoming professionals, like fresh out of passing the boards. I think a lot of people have this like expectation that the way it works is like you graduate, you get your credential, and then like the next day, like you go on like LinkedIn or something, and there's just like a spot open. You apply, you interview, and you get in. But the more that I got involved in athletics, I realized that it just doesn't work like that at all. Like a lot of those jobs aren't even on LinkedIn or anything.
Right.
Like usually they like call you or it's like a mutual connection. They're like, oh, they're looking for a sports PT for this team. But it's not just like an open job that you like easily apply for. It's very like, I would say kind of secretive, tight knit. And at the end of the day, it is, medicine. So it's also not like on ESPN, like they're saying, oh yeah, like the Miami Dolphins need like a new like sports PT because there's a lot of like laws and regulations and HIPAA and all that. So it's also very private in a way. It's not like, when a football team needs a new head coach that they're like, oh yeah, like this coach just got fired. A lot of the sports medicine stuff kind of happens like behind the scenes.
Yeah.
So that's just like something to keep in mind too, I would say.
Yeah, and I think it's all about from there. It's all about relationships, like you just said. Like I've had a couple teams even reach out to me and be like, "How are things going? Like we have an opening with the blank MLB team." Like it
Yeah.
really is. You kind of just make it known. I think the most important thing you can do is make it known that you want to be in that environment. If you make it known, you work your butt off. You're a nice person. You're good at what you do. It kind of just falls into place from there. If you're trying to force it, you're being like, I need to work for this team right now. Like that's just never how it works out.
Yeah.
It's not going to work that way. And same with me, like going into a PT school, I was like, yeah, I wanted to work, maybe for the Milwaukee Brewers, one of my favorite sports team or whatever. It's like, that's not just how it works. There's probably a PT that's been there for 5-6 years that might be there forever. Like the jobs are so few and far between. I think that you kind of have to just, work your butt off, put in the time, make the relationships, connections to kind of everything else will fall into place from there.
Yeah, that's something else that like you have to keep in mind, since these are like really top positions. Like like I said, really high paying, really high respected. It's like people usually that like once they get that position, unless they get fired or like they do something illegal, like they usually stay. It's like it's not a big what do you call it? It's not a big like turnover rate or anything. Usually it's like the same people stay there for years until they retire, because it's just a very good position that everybody wants. So that's something to like keep in mind.
Yeah. And then along those lines too, like even me, when I was looking into MLB, I kind of recognized that like this job isn't just going to open up at the MLB level. The reality is you got to work your way up kind of into the minor
Exactly.
league levels as a PT, working with the minor leaguers, maybe they're low A, double A guys, and then gain the respect to kind of work up the ladder from there, which that takes years and that takes time and that takes trust. And it just doesn't just happen. Like
Yeah.
it takes time, right?
It's funny because it's like it's the same like hierarchy like with athletes. Like you're talking about baseball, it's like you go triple A, double A, MLB. The same
Yeah.
thing if you want to be like a sports PT in the MLB, you got to start with the triple A team first, double. So it's like you're kind of like paralleling like like an athlete's course. But
Right.
we've talked a lot about pro sports because like I said, a lot of people are like really into that. That's kind of like a dream job for a lot of people watching this. But I know now you don't work with like a sport like a professional sports team. You work
Yep.
more in a clinic, I would say, right? Correct? In a sports performance clinic, sports physical therapy clinic, right?
Yep. Yeah. So I work for Twin Cities Orthopedics. I would consider myself a sports PT. I would say about half my caseload is probably athletes, and then the other half is general orthopedic patients. But I would say I'm one of the go-to guys for treating ACLs and like athletic shoulder injuries in the clinic. Just yesterday, I had a referral from one of my colleagues. He's like brought this girl over and was like, "I think you do a good job with this high school volleyball player. Her shoulder's bothering her. Take a look at her, get her to the next level." So people recognize you, especially if you've done a residency in that type of setting, as like an expert in the field in treating athletes. So yeah, I work in more of an outpatient kind of standard clinic practice. I work 4 days a week, Monday, Wednesday, Thursday, Friday, 10-hour days. And it's more of a standard schedule, much different than the training room where we never had a set schedule. So it's more like 40-minute appointments and get through it, and that's it. So.
Yeah, can you go really quick into that? Like kind of just like maybe like the pros and cons or like the differences between working with a team, like being a team physical therapist versus working the way you're working now, like in a clinic or like an outpatient. Like what are like the main differences?
I absolutely love working for a team at the University of Miami. Like it was a lot of fun. I think one of my favorite parts was just developing relationships with the athletes and my colleagues. I think you get so tight knit when you're in that
Yeah.
training room for however long it is, 14 hours a day sometimes. Like you really get to know the athletes well beyond their injury. You get to know your colleagues really well. Here we are talking, me and Danny, a year later. And that's one of my favorite things. The other thing that I liked too in the training room was I was able to utilize my entire skill set without like feeling like rushed in a 40-minute appointment or feeling like, oh, I can't do this because my colleagues don't do this. And I feel like in a training room, like I could do more, use more hands-on stuff, more like manipulations, and kind of really work towards the edge of my scope of practice, which is really fun. Now I tend to only see shoulders, knees, ankle, feet. So I really don't see spine much throughout my day. So I feel like, my skill set was much broader it's kind of started to narrow down a little bit because
Yeah.
it lets you do something, that you kind of get rusty with your skill set. So that's what I really loved about the training room, the relationships and my skill set. But like I said, on the flip side, now I'm working a little bit less, less hours, but I'm really applying what I learned at the University of Miami to how to best treat the athletes. I feel like people recognize what I did and where I was, and I instantly have respect from them, and then have trust right off the bat, which is phenomenal. So a little bit more work-life balance now. And I guess the other thing too is now, in the training room, I really learned how to, work with the docs, ATs, physician's assistants, working with my colleagues. Now I'm pretty kind of independent. I feel like
Okay.
I'm on my own, like treating my own. The docs never really touching it, touch base with you. Nobody's ever really looking over my shoulder. So in a way, it's a little bit more challenging that you kind of have to really get at what you do, and nobody's looking over your shoulder. So it's just another different part about working in a clinic, I would say.
Yeah, no, I can definitely agree with what you said about the training room. I really, there's a lot of times when, like, obviously in undergrad, me as an athletic training student, it was just like a lot of hours. With my classmates, I'd be like, oh, I have to go into the training room and stuff. But like now that like I did that, it's like I appreciated it. And even when like the days when I was like, oh, I don't want to go in or whatever, I went in and I felt amazing. Like, because you do meet a lot of people and you build these like relationships,
Right.
that it just becomes like kind of a like part of who you are and like
Yep.
what you're doing. Like it gives you like a sense of purpose too. Like I said, some like I would say that my mentality, like some days on my bad days, was like I have to go to the training room. But I would get to the training room and I'd be like, all right, I'm in the training room. It's time to work. Time to
I
figure
love
out like
this.
what I have to do. So it was kind of like, yeah, you talk a lot of like bad stuff or you feel bad about it, but once you're in it, it's like, no, this is why I'm here, and you just feel good. Um,
Yeah, you feel youthful, young. Like all the athletes are 18 to 22,
exactly,
like around
exactly,
your age. Like it's energizing, very energizing. The other thing I
exactly. It
want
is
to add too
energizing.
is like one of my favorite parts about the sports residency specifically is I always say this. There were times when I walked in the room and I was the smartest person in the room because I had AT students around me and they're like really wanted to learn about what I was doing. And then there were other times where I'd walk in the room and I felt so minuscule and so not important because, the physician, the orthopedic surgeon was there looking at the high level athlete, and my mentor was there and I was there and I felt so out of place, And so that's one of my favorite things I definitely miss is in that setting, when you walk in, you never really know what you're getting into. It might be one day you're teaching the student AT, student PTs how to do a technique, how to evaluate the shoulder. And then the other days you're learning from one of the best orthopedic surgeons in the country. And
Yeah,
it's
no,
just like,
that's true.
you know what I
Yeah,
mean? I always tell people that. I miss that. I really do.
yeah. Now that I'm like not practicing or anything, I'm just doing my post back and doing classes. That is something I miss. Like just like that networking, having people around you that have the same interests, even though they have their different credentials or they're in like a different hierarchy, different age, different like level of experience. But at the end of the day, it's still like one unit.
Right.
Um, and like I said, now that I'm not really involved in any of it, like I really do miss it. Like there's times I'm in classroom, like learning chemistry and stuff, and I'm like, wow, like I remember when I was in the training room like a year ago, like going over an injury and stuff like that. So it is really nice to be in that like team environment. And something that people also don't realize when it comes to sports and sports medicine is that when people think team, they think team as in like, an actual team, like a football team, and that's it. But what they don't realize is that there's so many other people involved. You have the sports medicine team, you have the people who work for nutrition,
Yeah.
you have all the coaches. It's a
Yeah.
whole people. It's not just a team itself. It's literally a unit. And it's cool to like network and just be in that world. So yeah.
That's awesome. Yeah. And then for anybody listening who, wants to get in this, I think just having an open mind, willing to network, and just putting yourself out there is the most important thing. If you kind of sit back in your shell, don't really talk to anybody, don't try a new skill, don't ask questions, you're not going to get very far, especially in
Yeah.
sports medicine.
Yeah, no, that's definitely true. I remember the first couple of weeks we as an athletic training undergrad, when we were all like, it was kind of our first week in the training room. We were all just like sitting back, kind of standing awkwardly near the athletes, not really talking to them. But the more experience you get and like the more confidence you get just talking, not even clinical skills, just
Yeah.
talking, meeting people, like the better it is because you make all these relationships.
Right.
Even you and me now. Imagine if
Right.
I was shy and quiet and I like never talked to you or anything.
Yeah.
This interview would not be happening.
Right.
So definitely be outgoing in a good way.
Yep.
Talk to people, even people that aren't in the same field as you, even if they're not sports medicine. Just get to know people because at the end of the day, it's all connections. So
you never know who they know or who they're gonna.
exactly.
When you apply for that job, they might be the reference check, and if they didn't like you or you were a mean person or whatever else, that's gonna come back to bite you later. So it's a tight knit. The sports medicine circle is very tight knit. So you gotta be careful and wise.
Now, the last thing I want to ask you, I think we threw out a lot of information. The last thing, just the final question, do you have any last piece of advice that you want to give to people watching this? Anybody who wants to be in sports medicine, anybody who wants to be a physical therapist or a sports physical therapist, just any last piece of advice?
Yeah, I think ask for help is the most important thing. In my young career, I maybe didn't do quite as good as a job as I could have about asking for help when I needed it. And I think in my personal life too, I think there's times where I could have asked for help on more personal life things. But the reality is I don't know it all. I have this really great experience, but have so much more to learn. I've been only doing this for a year and a half. Like I have so much more career experience to gain. And even the people I work alongside with day to day have worked, twice, 10 times as long as I have. And so I think, asking questions, asking for help, asking other people, how do you get down this sports PT path, athletic trainer, how you work for a professional sports team, asking these questions, hear different people's stories, and then start to write your own. I think that's the most important thing.
No, that was perfect. But I'm glad we were able to do this interview. I hope people watching this really got something out of it because, like I said, there's a lot of people that just want to know more about the environment, want to know more about sports medicine, being a sports physical therapist. So I'm glad that, you're here being able to inform and teach.
Absolutely. Thanks for having me on, Danny. And if anybody wants to reach out to me, name is Fernando Espinosa. I have a decent Twitter following. It's at FESPINOSAPT. Tweet a little bit here and there about physical therapy things, how to get in sports medicine. So feel free to follow me on there.
I'll make sure to leave the description down below or something.
Alright guys, that was pretty much it for the interview. Hopefully you guys got something out of it and you learned something. Fernando is really hardworking, really committed, really passionate about what he does. So Fernando, thank you again for letting me interview you. If you guys enjoyed this video, make sure to give it a thumbs up and subscribe to my channel down below to stay up to date with my weekly uploads. That is it for me, but always remember to stay hydrated.